Ted, can you hear us okay?
Yeah, I'm good. Can everybody hear me okay? Yes? Okay, perfect. And everybody's here. Rick's here. Dr. Sills. Is Megan?
Megan just got on.
Okay. BMAC on, Brad?
I have not seen BMAC yet. And as of now, Ted, everybody has permission to unmute themselves. So when we get going, they can just unmute themselves.
Got it. Okay. Well, I'll go ahead and get started. BMAC, I'm sure, will join here in a second. But don't want to waste a lot of time. It's not about me for sure. I know you guys don't want to hear me talk. But I did want to just say thank you to Megan and her team and Dr. Sills for taking the time to do this. We've been trying to find the right window for a couple weeks to get him for you guys. And so obviously he's extremely busy. And so Dr. Sills, again, I can't thank you enough for doing this. Rick, you too, and Megan for all your help. Just for the flow for ladies and gents on the call, Dr. Sills is going to open up. He's got a really brief presentation he'll take you guys through, and ladies, and then we'll go ahead and open it up for Doc and Rick. And just so you know, Mark Donovan will be available for you guys tomorrow after practice. So in the window, it won't go as smooth as normal. It'll be coach, player, and a little bit of a break because Mark has a meeting. But you will get Mark tomorrow, just as you formulate your questions for today. So without further ado, Dr. Sills, thank you.
Okay, great. Ted, thanks so much. And hey, great seeing everybody. Appreciate the chance to be with you. Going to give you just a couple of quick slides off the top to talk through some things before we kick it off for questions. So if you go to the next slide, Megan, obviously, you know, the foundation of all this work goes back really to March when we started meeting together with the Players Association. We put together a joint task force, and that task force had 7 sub-task forces which came up with these different protocols. So you can see that these range everything from the facilities to education to how we travel to obviously screening and testing to what we do with responses from those test results, certainly the game day protocol, and then media. So each one of these is between a 20 and 50 page document in and of itself that goes through all of the different aspects of that particular area. And it applies across all of our clubs. And really in doing this, what we did was something that's quite remarkable. We essentially went to each club and challenged them to reimagine and reinvent everything about their operation, from the way you gather to the way you come in the facility, to the way you eat, to the way you train, to the way you give medical treatment. Everything about it really had to be reimagined and reinvented against this idea of mitigating risk. And so that was really what drove the creation of all of these different protocols. Next slide. You know, I think probably one of the more tangible areas is in the facilities. And so you see changes that have been made. I'm sure some of you have been around the facility and you see distance being enforced, things like plexiglass modifications between lockers, but even fundamentally before you get in the building, you know, traffic flow patterns, who goes into where, the amount of disinfection that's done. As I said, really every aspect of the team's operation has been reimagined and reinvented and overhauled to mitigate risk. And each club has an infection control officer who's ultimately responsible for implementing all of these changes. And they have what's called an IDER, which is an infectious disease emergency response plan, which basically says, hey, how are we as a club in Kansas City, how are we going to translate those protocols to our facility, to our stadium, to our team? And so each team had to submit that to the league. It was reviewed by the league, it was reviewed by the players union, and it was reviewed by our infectious disease experts to make sure that it was compliant. And we're really proud of the work done in Kansas City. Again, I tip my hat to Rick Burkhalter, to your entire medical staff, Mark Donovan, the whole operation, Coach Reed. I mean, from day one, everybody bought in on this idea and said, what can we do to do our part to make this as safe as possible? And I think you see that throughout the facility. Next slide. You're familiar with testing and the important role that it plays. We did partner with BioReference Laboratories, a national lab company, who essentially built an on-site lab at every one of our 32 clubs. And you can see at Arrowhead Stadium, it's outside in this trailer. Inside this facility, if you will, are certified technicians who gather the tests on a day-by-day basis for all players, coaches, and staff members. Those samples are collected. They're then sent away to be analyzed in one of our reference labs and reported back within 24 hours to the team. So again, this is part of our testing protocol. It happens every single day. And I think it's worked extraordinarily well. If you look, as we reported yesterday, we're right at about 200,000 tests that have been done across the league. And each day, as Rick can tell you, all of his players, coaches, and staff are going through this, but doing it in an efficient way that gives us results back, within 24 hours. So it's been a very solid program for us. Obviously, we had a bit of a hiccup over the weekend that we can talk about, but on the whole, I think this has worked extremely well. Next slide. What happens with those test results is governed again by that treatment protocol. So should someone test positive and we confirm that test, it depends whether they have symptoms or not. You can see they enter down a couple of different pathways, which again reflects the CDC guidance on how to manage these. I do want to call your attention to that bullet on cardiac screening. There's been a lot of talk and discussion about, can you have cardiac or long-term heart effects after COVID infection? And that's not novel to us. That's something we've been talking about all throughout. In fact, in medicine, it's known that you can have cardiac complications after a lot of different viral illnesses. So built into our protocol is that players who test positive and have recovered will undergo additional screening. They get some additional screening tests that are done. Also, those players who've had a positive COVID infection have to go through a graduated exertion protocol and then be ultimately cleared by the team physician staff to be able to come back. So I just want to point out that the issue and the concern about cardiac and other complications, it's actually built into our protocol and has been there since the start, something that we're looking for and checking in any of these cases. Next slide. I think technology has been a really big part of this season. On the left, you see some prototype designs for the Oakley Mouth Shield, which is this additional visor-like device that fits on the bottom part of the face mask. We're currently about to roll out the version 2.0 of that based on player feedback from version 1.0. Obviously, we're trying to strike a balance of reducing any droplets that might get out, but allow air exchange. And so Oakley took a version and tested it with a number of players, got that feedback, and have now modified it to a second version that they're going to be implementing soon. We think that's a solution that some players will choose to wear to, again, help mitigate risk. The picture of the lanyard and the little small chip-like device in there is our Connexon tracing device. It's a proximity tracker. It measures who's close to who. Everyone in the club environment, players, coaches, and staff, pick that up when they come in the morning. They wear it all day at the facility, whether they're lifting weights, attending meetings, treatment on the practice field. We'll continue to use that on our travel, with game day travel, with at the stadium during the game. It gets turned in back when they leave at night. But what it creates is an immediate, very detailed record of who's around who and for what length of time. And that's an enormous advantage because contact tracing is normally really hard to do. You know, you get someone who's positive and say, okay, you were positive. Who's everyone that was around you over the last 2 days and how close were they to you and for what length of time? And obviously people's recall of that is not very exact. So this gives us an immediate, exact record of who might have been exposed to anyone who does turn positive. But it also does something else really important that I know Rick and Coach Reed and the staff have done, and that is day by day, they can look and see how good a job did we do with our distancing. You know, were we keeping apart in the meeting room? People spread apart when they were getting treatment or if they're lifting weights. And so it allows us proactively to go in and modify any of those areas or times or activities where we might not have done what we wanted to do on the distancing side. So I think it's an important tool and an adjunct for us, and one that's going to help us not just if we have a positive case, but help us also make sure we're doing a really good job with distancing. The other part of the slide you see on here is the fact that you're going to see a lot of hydration changes and things like that. You know, single bottle use. You won't see trainers running out, squirting in everybody's mouth. That's just part of our new world in COVID. Next slide. And on this, so just to tie it all together, to say that we've done a tremendous amount of education, and that's ongoing. Again, I tip my hat to Rick Burkholder, the medical staff, Coach Reed, the coaching staff. Everybody has really, really emphasized education, education, education. And this, again, isn't just about players, but coaches and staff. What do we do to keep each other safe? Not only when we're at the facility, but when we're at home or away from the facility. So we've got a lot of signage up. We've done videos. You can see the messages that continue to be reinforced. And that's something we have to continue on with, because we always say that it's when we get complacent is when we become vulnerable. So you'll see that educational messaging continuing to go out. But I'm really proud, again, of the job that our players, coaches, and staff have done thus far. I think they've really embraced this and taken it to heart to say, how can we keep each other as safe as possible? Megan, I believe that's our last slide. So with that, I'll stop and turn it back over to Ted and Rick and see if we want to take some questions.
Yeah, Doctor, it looks like we've got a few hands up. Let's start with Seren Petro. Go ahead, Seren.
Doc, thank you very much for the time. I'm curious, you said test results within 24 hours. Is that's something that, people outside of the NFL are still having a trouble with? Is that just simply, how are you guys able to do that? What is it? Is it, paying the extra money, or, how are you able to get those results in 24 hours where I've got, a friend who's on day 6 and still waiting?
Right. So, Seren, one of the things we did is when we set up our testing program, we chose a single national vendor that would service all our teams to make sure that everybody had the same level playing field with the type of tests that were being done. And that vendor basically set up a separate business for us where they're handling and processing our samples separate from everything else they do. So one of the things we said is we don't want to have a negative impact on the healthcare system in any market, right? We didn't want to come to Rick Burkhalter and say, Rick, go find a hospital in Kansas City that can run all your tests for you, because we did not want to in any way impede or inhibit the local healthcare facility. So we set up this separate network where, again, they've created a testing station at each team. They then process these and send them to their labs with a distributed process that's, again, just distinct from anything else. And so there's never a way that we're going to cross over or inhibit what healthcare needs, whether that be hospitals, emergency rooms, freestanding clinics. So as part of that, yeah, the logistics, really when you talk about turnaround times, the tests themselves take the same amount of time to run, right? No matter who's running the test, what machine, it takes a certain amount of time. It's the logistics of getting them to the lab and getting them on those machines and getting them reported, which we asked them to do. And the reason we're pretty insistent on that is obviously we want that information, fed back as quickly as possible, because the goal of the testing program is we're trying to do surveillance. We're looking to see, is anyone becoming newly infected inside that team environment? Because if they are, we want to isolate them, get them the appropriate care, but make sure we remove them from the team environment as quickly as possible. So that's a different testing paradigm than what hospitals, clinics, and things like that are doing, or typically are testing people that show up with symptoms or, are having some other type of illness.
And then just as a follow-up, the teams are using the concourses at the stadiums are using both team locker rooms. When we get down to playing games and some of the teams are having fans in the stands, seemingly those concourses aren't available. You're having to house both locker rooms. How would you describe what's going on now? An overabundance of caution that's not necessary, that then won't be used on game days, or still a hurdle to be cleared?
Well, I think an abundance of caution is something we want to exercise throughout, and so we have different protocols for game day. I think in training camp you have to realize you've got many more players than you do during the regular season, and you've got more staff around, and so logistically you have introduced some complexities, and I think that's why teams like the Chiefs have been able to utilize their stadium and really spread out. Certainly, as we get into season, we'll make some modifications, but the same principles apply, which is going to be appropriate screening, appropriate testing, physical distance, and everything that we do in modification of all those routines. So just because we start games, it's not going to change all of those basic principles.
Let's go to Herbie Tiopi with the Kansas City Star. Go ahead, Herbie.
Hey, good afternoon, Doctor. Thank you for taking a moment to talk to us. Realizing that COVID is obviously a very fluid situation, and we don't know what's going to happen tomorrow or even sometime in December, but I'm curious because there seems to be a lot of question on what exactly is the protocol if you get a team that has positive tests on a Friday, and how does that affect the game week?
Well, I think, first of all, Herbie, our most important goal is we want to keep everyone safe. That's more important than anything else. And I think everyone from the commissioner on down would say, yes, games are important, and yes, our season and our league and our schedules, they're important, but safety is our number one goal here. So I think anytime you look at, as we approach game day, that's the lens we're looking at it through. Is we obviously want to arrive at game day with teams, players, coaches, personnel who are not infected, and do everything we can to keep them safe during the game. And so as we think about testing and screening leading up to the game, again, that's what it's designed to do. We don't want anyone to get on a team plane and travel if we think they might be infected. So we do have in place protocols that'll be looking at all of those aspects. But I think, again, it's important to realize that it's the safety of everyone involved, not just players, but coaches, staff, and everyone, because we look at that as one team environment. Everyone's sharing the same ecosystem together. And so anyone in that environment who gets infected can affect everyone else. And so that's why this isn't just about players. But it's also not just about testing. And I think this is something really important, Herbie. We always say testing is not what keeps us safe. Testing is about containment, right? If someone is infected, identifying them and removing them. What keeps us safe and keeps us from getting infected are all those other things that we know that work. Using a mask, physical distance, not showing up if you're sick, reporting your symptoms, doing the screening. It's all those things that we have to do. And no matter how frequently we test or when that test happens relative to game day, if we don't do a good job on all those other things, the testing is not going to keep us safe. So I think that's an important message. Again, it's one that Rick Burkholder and his staff have done a great job. And I know that Coach Reed has really reinforced this as well, that we got to be on top of our game at all times. It's not just show up and get our test and now go do football as usual. We got to be consistent with applying all these principles, both at the facility and away from the facility, if we want to show up on game day and be healthy.
Go to Nate Taylor with The Athletic. Go ahead, Nate.
Hey, Dr. Alan Sills. My question is mostly about travel. I think you mentioned earlier that there's going to be tracing involved with traveling on the team plane and perhaps maybe even in getting to the hotel. Just how much is that still being discussed, or do you feel, I guess, how confident do you feel with the plan that's put in place when a team leaves the facility to when it arrives at their visiting locker room for game day?
Yeah, Nate, so we have a really extensive travel protocol, and I'm sure that Rick Burkholder can quote large sections of it to you. I mean, it's incredibly detailed, from how you room players in hotel rooms to who sits where on a plane to meal service to bus driver. I mean, everything in there is spelled out. So obviously we all know that travel introduces some variables, but we've tried to go to great lengths to think about every one of those. Again, how can we minimize and mitigate risk? And I think Rick would confirm for you, you're going to see everything done differently than we've done before. Again, from how we travel to where we sit, to how meetings are done on the road, to arriving at the stadium, to who's allowed in the locker room. One of the big changes you'll notice immediately is how many people are on the field, or maybe I should say how many people are not on the field. You know, we've gone through and sort of surgically excised a whole lot of people out of there. Probably I'm going to hurt some feelings of somebody on this call, because you're going to have a lot fewer people on the field, again, because of reducing the risk to everyone out there. So I do think travel is something we recognize as a vulnerability, but we've really gone to great lengths together with the union to think about all those aspects and to try to mitigate risk as much as possible. Rick, you may have something you want to add on that too.
Yeah, so two parts to the question. Back to the question about the locker room. Remember that we started this camp with 90 ball players. On game day, we will only have 47 in the locker room. So we're just about half. So we can put them in the two locker rooms, because you're not going to, with your 53, you're not going to have those extra players in the locker. At least we aren't going to have those extra players in the locker room. We're not allowed injured players in there. So the locker room space, although it hasn't changed, our numbers and our approach to home games and away games, it has changed. And then, like Dr. Sills said, the protocols are so detailed, and really it's my responsibility, but everybody, it takes the whole village to do it. And we're going to be fine with it. We haven't told our players about the travel changes yet, because we don't want them to worry about that right now, but we will enforce those. And Mitch Reynolds and I are really working hard right now to make sure that those are correct, and that we're distance on the plane, and that the food service at the hotel is to our level of protocol. And then we're starting to talk about how we're going to handle the bench. You know, Doc and I had a discussion the other night. Simple thing, guy runs off the field, and we have that universal water bottle where we give them a shot of water and they go back to the next play. Well, that's got to change now. They've got to have their own drinks. So there's a lot of details to it, but it's nothing we can't handle. And you got to know this about the National Football League. So COVID, it's a monster. But we've had protocols in place for a lot of other things that we've had to do in the past, led by Dr. Sills, mandated by the National Football League and the NFLPA, and carried out by the medical staff. So this is a bigger one than normal, but we've had to do that in the past. And I'll take my hat off to the brothers and sisters in athletic training in the league. Everybody's responded the same way that we have at the Chiefs, and it's all led by Dr. Sills. But we're following the protocols, and those protocols were not something that was thrown against the wall. That was months and months of experts coming up with the protocols.
All right, guys, we've got time for a couple more. Let's go to Sam McDowell with the Kansas City Star. Go ahead, Sam.
Hey, Doctor and Rick, appreciate the time. I guess this question probably applies to both of you. You mentioned how much time was put into coming up with these protocols. Now that you've seen them in place for, nearly a month now, what do you think of the success of them?
Well, I think there's two things, Sam, I would say. We announced yesterday that from August 12th through August 20th, we ran over 58,000 tests on players, coaches, and staff, and we had 0 confirmed positive tests among players, which I think is really remarkable. I think, again, that just speaks to the great job that our medical staffs, our coaches, our players, our team staffs are doing here. At the same time, it's way too early to celebrate. In football terms, we scored on our first drive, but we still got a lot of football left to play in this game. And but I think what it does say to me, Sam, is this stuff will work. If we can continue to be disciplined and vigilant, then we can keep ourselves safe and healthy. But it takes an everyday effort. And again, much like a football game, we got to play all the way through to that final whistle. So I think we're encouraged. But I also would say, Sam, that those protocols will grow and change and evolve because we're going to learn new things. We've already changed our testing protocol a couple of times based on what we've learned through those 200,000 tests. And they will continue to change. But they'll change for the better because we're going to be learning and growing with what we do. So I think the protocols, I'm pleased with where we are. We know they'll continue to get better. But the news so far, I think, through the first 4 weeks is certainly encouraging to us.
Yeah, I would just jump in, Sam, and say, so Dr. Sills touched on this. These protocols are amazing, and the testing is the focal point, right? According to all the so-called experts and everything, like, oh my gosh, you're doing all this testing. That's not what's keeping us safe right now. It's the players buying into, and I emphasize this to our players. I spoke to them last night. Andy has me speak to him about every 3 or 4 days about COVID. And the 3 W's are a big deal to us in Kansas City. So wear a mask, wash your hands, and we've taught them how to wash their hands, and then watch your distance. And like Dr. Sills said, I go every morning and look at our report from the day before where we're at distancing wise. If I see a bunch of guys too close together in meeting space, I call facilities, they spread the chairs out again. Or if it's one group like the running backs, I'll call Dealin McCullough and say, look, you got to spread your guys out in the running back meeting. I'll be up tonight when you start to get them spread out. Those are the things that are making it work. The testing, like Dr. Sills says, is surveillance, and it's confirming that our protocols are working. Now, we're getting to the next step where we're playing games and travel, and we'll be just as vigilant, and hopefully it'll work out because people, I saw a lot of stuff yesterday saying, oh, these numbers can't be right. No, these numbers can be right. It's different than the rest of the United States because so many people aren't washing their hands. So many people aren't wearing masks. So many people aren't honoring distancing. If you do those 3 things, you're going to be fine at your house, at a restaurant, at wherever. It's just not happening across the board like it is in the NFL because we have the COVID police to do it.
Let's go to Matt Derrick. Go ahead, Matt.
Hey, Dr. Sills, I appreciate your time. By my count, there are 5 NFL teams that will be allowing fans into the stands to start the season, and as of now, the Chiefs are one of them. Curious just how closely you'll be watching those 5 cities, in particular Kansas City, since it will be the first game, for what, if any, community spread emerges from these outcomes and from these events. And followed up and connected to that, was there any concern you had over the weekend from the reports and some of the videos that showed fans in attendance at Arrowhead for practice not wearing masks?
Well, Matt, I'm always watching Kansas City carefully because of Rick Burkhalter, right? I got to keep that guy on a short leash there. So, no, I'm just teasing about that. He's terrific at what he does. First of all, of course, we're going to be watching really carefully. And those decisions about fans, understand that's not made in isolation. That's not the Chiefs deciding on their own or the NFL deciding. Those are carefully thought out decisions that involve public health experts, both nationally, locally, and at the state level to think about what appears safe in each community. And I don't think it should be a surprise, Matt, that it's not the same everywhere because we're in different stages of the pandemic in different areas of the country. So I do think it's obviously something we'll continue to track. And to your point, yes, you bet. We'll be looking afterwards to say, were there any public health after effects? Because we've been very adamant all along that whatever we do, we want to support and further the public health effort and not hinder it in any way. So that will be an ongoing dialogue. And I think, again, that's not a one-time decision. That's something you continue to evaluate based on where each community is and where we are as a country. And I think similarly, when you think about, fan behavior, everyone's learning here. Everyone's going through a learning curve. And I'll just tell you, I'm a surgeon. I work in a hospital. There's not 100% mask compliance in the hospital as much as you'd want. People still need reminders. And so I think that fans understand and they're going to continue to modify their behavior. I think the club has done a great job. I know Coach Reed, I know Pat Mahomes, others have put messages out. I think you'll continue to see fans get used to this new normal. It is a change in behavior. I mean, one of our athletic trainers said it well. He said, it doesn't feel normal because it's not normal, right? It's not what any of us have used to been doing. I mean, as a surgeon, I've worn a mask every day for 30 years of my life. It feels really normal to me, but it's not normal to everybody else. So it takes time to develop those habits, but I think people are committed to it. You're going to see that continue to get better. And I have great confidence that the people of Kansas City and our fans there, just like other places, are going to embrace that because they want to be safe. They want to keep each other safe, and they want to keep watching football. So I expect positive change there for sure.
All right, guys and ladies, thanks a lot. Dr. Sills, again, you and Megan, again, you guys carving out some time for us is much appreciated. Thanks a lot. And maybe, who knows, maybe down the road as things go, we can maybe do this again. So I can't thank you enough.
Great. Thanks for having us. Appreciate it, Ted.